open the door, check the chart, perform my hand hygiene, make sure I have my supplies. I've got my stethoscope. I want to clean the diaphragm and the earpieces of my stethoscope. Come in, introduce myself. Hi, I'm Jennifer. I'm going to be your nurse today. And can you tell me your name and date of birth? Verify that. Okay. Bob Radford, 2/29/1965. Okay. So today I need to do an abdominal assessment on you, and then I also need to give you your medication through your G-tube. So do you have any questions before we start? No? Okay. So first I would get my vital signs, and I want to check the temperature, the pulse, the respirations, and the blood pressure. I want to ask my patient if they're having any pain. Are you having any pain today? No? Okay. So now I'm going to get the patient ready for the abdominal assessment. I want to keep them in a supine position, so they should be laying flat with their head can be slightly elevated, but mostly flat. And then I want to expose just the abdomen. So I'll expose the abdomen, and first I want to inspect. So I want to look to see if I see any scars, any wounds, if they have any incisions or anything like that. I would want to document that. I want to look at the color, to see if they have any distension, like abdominal, swelling, if they look bloated. And then the next thing I want to do is listen. So I already cleaned my stethoscope. So I will listen in each quadrant for 1 to 2 minutes. And if I don't hear bowel sounds, I would listen for 5 minutes. So I want to start in the right lower quadrant and work around clockwise. So first I want to listen. I would listen for 1 to 2 minutes for bowel sounds. Then I'm going to go up to the right upper, and the left upper, and then the left lower quadrant. After I listen, then I want to ask again, make sure you're not having any pain. They said they're not having any pain, so then I need to palpate. And I'm just going to palpate, starting in the same way that I listen. I'm going to start in the right lower quadrant. And you want to look at their face while you're palpating, just to make sure that they're not making any like frowning faces or anything that looks like they're in pain. So I'm just going to lightly palpate in the right lower, right upper, left upper, and then the left lower quadrant. I don't feel any masses or any distension, so that's good. So then I'm going to go over and do my G-tube medication. Okay, before I give anything through the G-tube, I do want to make sure that my patient is elevated, that they're sitting up. So the head of the bed should be up 30 to 45 degrees. So I'm going to go ahead and sit them up, get them ready for their G-tube medicine, okay? And then I'll come over here. This is my G-tube, my patient's stomach. I've got my medication, a pill crusher. I've got my pH strips. I need to have 3 medicine cups, something to stir my medicine with. And I've got my syringe, some water, and something to put my residual in, okay? So I want to go ahead and I want to get my things set up. Okay, so I've got my 3 medicine cups out. I would have, on the day of the skill, you'll have, the medication will already be crushed for you. So you'll have a little bit of like powdery crushed med in here, okay? So this will be my medicine. The first thing I need to do is check for placement and also check the residual. So to I want to find out like how much is left in their stomach maybe after their last feeding. Anytime I'm doing anything with the G-tube, I do want to make sure I have gloves on. So for the skill, either you can put gloves on or tell us that you would put your gloves on, okay? So first thing, I'm going to check my patient's residual. So I'm going to take this tube and I want to pinch it, because when I take the cap off, I want to make sure that they're not getting air into their stomach. Go ahead, put the syringe in there, and then as soon as I pull that up, I can pull back the residual. So for the skill, we will just tell you when to stop. In real life, when you're pulling back residual, you will start to get resistance and won't be able to pull anymore, and that's when you know that that's all you can take out. So for the residual, go ahead and put this cap back on. I want to check to see how much residual I have, and then also the color. And then I do need to check the pH to check for placement. So the pH should be between 0 and 4 because the stomach is very acidic, and I want to make sure that it is in the stomach still. So I've got about 20 milliliters of residual, and we'll say it's kind of a yellow color. I'm going to put the residual here, and then I want to check the pH. So I'll check the pH, and it's 2, so it's good. So it is in the patient's stomach. So the next thing I'm going to do is go ahead and get my medication ready. So I need 2 flushes, and then I need to put in some water for to dissolve the medicine, the crushed medicine. So you need about 20 to 30 milliliters of water in each one of these. Okay, I'll put my water in. All right, and then we're giving our medication by gravity. So I want to take the plunger out of the syringe. Okay, and this is where I would have my gloves on. So the first thing I want to do, I'm going to pinch that tube, put the plunger in, and first I'm going to give back the residual. I want to give back the residual because I don't want to cause my patient to have a fluid or electrolyte imbalance, so I'm going to give them back what was in their stomach. Okay, give that back. And then as soon as I raise up the syringe, it's going to go in by gravity. As soon as it gets down into the tube, I want to pinch it down again because I don't want a lot of air going in. Then after you give anything, you want to do a flush. So this is my flush, so that's just water. I'm going to let that go in to kind of clear out the tube. Let it go in by gravity. Next thing is my crushed med with the water. Put that in. Let that go in by gravity. Once it's down to the tube, I'm going to pinch it again. And then lastly is my last flush. Okay. Let that go in. Okay, and then we're finished with that. I want to take that off, put the cap back on, just clean up my area, okay? And then next thing I want to do is do my patient teaching. So for my patient teaching, I can tell them that they need to keep the head of the bed elevated 30 to 45 degrees for at least 30 minutes to an hour. The reason for that is we don't want them to aspirate. So what we just gave them, we don't want that to happen. So I would tell them that and explain that to them, ask them if they have any questions. If they don't have any questions, then I just want to make sure that I leave them in a safe position. I have them covered back up. They've got their call light, and the bed rails. I can pull the bed rails up if they need to be up. And then when I leave the room, I would perform my hand hygiene again, and then I want to document my findings. So the things that I would document is basically everything you did. So just go back and think, okay, when I did my abdominal assessment, so the abdomen was flat, non-distended, no complaints of pain, no scars or incisions. The patient has active bowel sounds in all 4 quadrants, and then I gave them their medication through their G-tube. They tolerated that well. I want to also document about the residual, how much the residual was. They had 20 milliliters of residual yellow fluid, and the pH was 2, so good placement. And then and that's it. Okay, I would maybe also document about my patient teaching, the informed patient and family members to keep the head of the bed elevated for at least 30 minutes to an hour after anything, after the feeding or any medication through the G-tube. And if I had any abnormal findings, I would let the provider know. And that's it.